So, as we mentioned earlier, there are several standardized approaches in terms of identifying depression, and so this just happens to be one of them. Again, there are many that are out there, and so it's not as though you have to use the PHQ-9, but that's one that has become more readily accepted, and it actually goes through all those different symptoms that we had talked about in terms of depression. So it's a 9-item self-administered questionnaire, so you can actually give it to the patients and they can fill it out on their own, and it is also available in multiple languages. So primarily for the groups here in Hollywood, we would want to make sure that it's available in Spanish, and it is. So that's something that you can download from the internet if you wanted to find it. So it closely follows the DSM-4 criteria for depression, and it's been validated not only for diagnostic assessment, so not only for identifying depression, but it's also been validated in terms of following up patients and seeing are they getting better or are they getting worse, and that's really important in terms of seeing how our patients are doing as they come in over time. And as I mentioned, it's available online. You could just Google the words PHQ-9, and usually the first or second term is going to be the actual PHQ-9 instrument itself. And I just happened to put on here one of the websites that it's available at, since the Pfizer company was underwrote the development of the PHQ-9.
Can I just address something that
Sure.
I've seen in our community is that, and this is where I question the PHQ-9, but, one patient, you just made a statement, it tells us if the condition is getting worse or not. And what I'm starting to see is just really there's high lows, and, a patient comes in and says, I'm feeling fine, and then they have a stressor the following day, and they're completely, the PHQ-9 scores are much higher. And that's the challenge that I'm having in working with my patients, is really having them understand how to complete the form, really understanding the 2-week piece. But I don't know if you guys have had this experience or anyone else, but I guess I'm wanting feedback as to how to address that.
So just for the camera purposes, just to sort of summarize, the comment was that with using this instrument, the PHQ-9, sometimes we see that people's scores on on a given day is might seem okay, and then all of a sudden 3 or 4 days later something bad happens. They max out on the scale, and then it sort of comes back down again. And what do we do about these sort of different numbers that we keep seeing? And I think that the main thing to keep in mind is that this is tracking symptoms. Certainly there are going to be changes that happen from time to time, particularly as stressors happen. So I certainly have experienced the same sort of thing when I've used the PHQ-9 in terms of administering it to patients. I think that the main thing that you want to see is a trend. Are they getting better? And we know that there are going to be blips that happen when experiences such as what you mentioned. If something bad really happens, somebody loses their job. Let's say somebody close to them dies. We know that that is going to add additional stresses. It's going to make the situation much worse, and of course they're going to be feeling every day a lot of these same symptoms. But I think that as we're tracking people over time, we do see that there is going to be some variability, but overall, if let's say that we're treating them with psychotherapy or we're treating them with medications, we would want to see overall accounting for those blips that happen, and we want to make sure that we can explain them. But if we see that the trend is getting better, we could probably infer from that overall it seems like they're doing better. Now, on the other hand, if the trajectory keeps getting worse, that would probably suggest that what we're doing right now may not be working, and that we may need to change or augment the kind of treatments that we're providing for our patients.
And when you're tracking changes, are you tracking them on a monthly basis, week? What seems to be the trend?
So I think that this varies across, how frequently people come in. I think that initially, it makes sense every time that you have a contact with a patient that you would want to see how they're doing. I think that once people become a little bit more stable, you can certainly track it on a monthly basis if that makes sense for the patient and if they can do it. I think that once people are doing a lot better and you're let's say, just tracking to make sure that they're not getting worse, that they're sort of in this maintenance phase of treatment, I think at that point you could probably space it out to every couple of months, depending on how frequently they're coming in. And again, for the kinds of patients that we're often working with, it's not easy for them to get over to where we are. So I think that it might be helpful in terms of not only doing it when they come in, but potentially also if somebody's outreaching to them or having them do it at home, because again, this is something that can be self-administered, so they can also recognize on their own, I know my symptoms are getting worse. I need help. I need to come in. So how many people have seen the PHQ-9? Nobody can read this slide from back there. So, is anybody in here unfamiliar with using this PHQ-9? Okay. So I think that this is in the handouts. But again, what I would just say is that. Just to briefly go through it, what it asks is, over the last 2 weeks, how often have you been bothered by any of the following problems? And those 9 things that we talked about earlier are actually each on here. Little interest or pleasure in doing things, feeling down, depressed or hopeless, trouble falling or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself or that you're a failure or you've let your own family down, yourself or your family down, trouble concentrating on things such as you're reading the newspaper or watching television, moving or speaking so slowly that other people notice it, or the opposite, being so fidgety or restless that you've been moving around a lot, much more than usual, and then thoughts that you would be better off dead or hurting yourself in some way. So again, these are all the same sort of symptoms that we talked about earlier. Now, what it asks, as I mentioned, is over the last 2 weeks, how often have you been bothered by these symptoms? And there are 4 different breakdowns in terms of how frequently this is happening. And so there is a column here that says not at all, which scores as a 0, several days out of the past 2 weeks, which scores as a 1, more than half of the days, which scores as 2, and then nearly every day, which scores as 3. And I think the next slide shows an example of what might happen if somebody fills this out. So this individual goes through the PHQ-9 and says, when I look at this question about over the last 2 weeks, how often have I been bothered by any of these problems? They think, so the first question is little interest or pleasure in doing things. And if the person feels like it's been happening more than half of the days, they put a little check in here, and this signifies a 2 on the score. And what we do is we go through each of these lines, and at the very end, we total up the sums. So in here, it's a total of 15 after they've gone through all of these. And then, as we talked about from the earlier comment, if somebody's really depressed, they're just going to mark off everything here on nearly every day. They often, I often see patients go through this, and they just kind of just scroll through it as fast as possible, and you know that things are just bad. And I don't think that you necessarily need to treat the number per se. I mean, I think by that point you kind of get a sense that things are not going so well. So it is helpful in terms of having a number to get a sense of where patients are, but I think that as we work with patients, we also have that same sort of sense too. This is just another way of us being able to identify that if we're not totally sure.